Turmeric is famous as one of the healthiest spices in the world. But did you know it can sometimes be dangerous, especially if you're taking certain medications? Here's when turmeric can harm instead of heal. Turmeric has gained a reputation as a natural wonder, packed with anti-inflammatory and antioxidant properties. Thousands of studies confirm its benefits for pain relief, improved digestion, heart health, and even cancer prevention. But like any powerful remedy, it's not without risks. The active compound in turmeric, called curcumin, is responsible for most of its health benefits. It fights inflammation and boosts immunity. However, this same compound can interact with medications in harmful ways, turning this healing spice into a potential hazard for some people. Let's dive into the biggest risks associated with turmeric, especially when combined with certain medications. First up are antihistamines, commonly used for allergy relief. You might think turmeric would complement these drugs, but the opposite can be true. When combined with antihistamines, turmeric can actually trigger allergic reactions instead of preventing them. This unexpected interaction may lead to rashes, hives, or even breathing difficulties. If you rely on allergy medications, it's crucial to be cautious with turmeric use. Next on the list are blood thinners, also known as anticoagulants. Turmeric naturally has blood-thinning properties, which is usually a good thing for heart health. But when combined with drugs like warfarin, clopidogrel, or even daily aspirin, it can significantly increase the risk of internal bleeding. The effect is like doubling down on blood thinners, potentially leading to dangerous consequences. For those managing diabetes, turmeric presents another potential risk. While the spice is known to help regulate blood sugar levels, combining it with diabetes medications can be tricky. Turmeric may enhance the effect of these drugs, causing blood sugar to drop too low. This can result in hypoglycemia, with symptoms like dizziness, confusion, or blurred vision. If you're on diabetes medication, it's essential to monitor your blood sugar closely. If you decide to incorporate turmeric into your diet, surprisingly, even antacids can become problematic when mixed with turmeric. While turmeric is often praised for its ability to soothe digestive issues, combining it with drugs like omeprazole, famotidine, or ranitidine can backfire. Instead of reducing stomach acid, this combination may actually increase acid production, leading to nausea, stomach pain, or worsened acid reflux symptoms. It's not just medication interactions that pose a risk. Some people may be sensitive to turmeric itself, even without any drug interactions. Possible side effects can include skin rashes or eruptions, upset stomach, and allergic reactions. In rare cases, severe allergic reactions like anaphylaxis can occur. This is why it's always smart to start with a small amount if you're retrying turmeric for the first time. Given these potential risks, you might be wondering how to use turmeric safely. Here are some key tips to keep in mind. First and foremost, talk to your doctor if you're taking any medications, especially those for blood thinning, diabetes, or acid reflux. Your healthcare provider can offer personalized advice based on your specific health situation and medication regimen. When introducing turmeric into your diet, start small. Try adding it to food in culinary amounts before considering stronger doses or supplements. This gradual approach allows you to monitor how your body reacts and reduces the risk of adverse effects. To maximize the benefits of turmeric while minimizing risks, combine it with black pepper and a healthy fat. Black pepper contains piperine, which enhances curcumin absorption, while healthy fats help your body process the beneficial compounds more effectively. A simple way to do this is to add a pinch of black pepper and a drizzle of olive oil to your turmeric spice dishes. It's important to avoid high doses of turmeric, unless you re-enter the supervision of a healthcare professional. While turmeric is generally safe in food amounts, concentrated supplements can be much stronger and potentially more likely to cause side effects or interactions. Remember, natural remedies like turmeric are powerful, but they must be used wisely. Just because something is natural doesn't mean it's always safe for everyone. Your individual health profile, medications, and sensitivities all play a role in how your body might react to turmeric. For those who can safely enjoy turmeric, its benefits are numerous. It's been shown to reduce inflammation throughout the body, potentially easing symptoms of conditions like arthritis, inflammatory bowel disease, and even some types of cancer. Turmeric may also boost brain function, lower the risk of heart disease, and help in managing depression. However, it's crucial to approach turmeric use with a balanced perspective. While many people experience significant health benefits from incorporating this golden spice into their diet, others may need to be more cautious. The key is to listen to your body and work closely with your healthcare provider to determine the best approach for you. If you're considering adding turmeric to your health regimen, here are a few more practical tips. Choose high-quality turmeric from reputable sources. Whether you're buying the whole root, ground, spice, or supplements, quality matters. Look for organic options when possible to minimize exposure to pesticides and other contaminants. Experiment with different ways to include turmeric in your diet. While golden milk and curry are popular options, you can also add turmeric to smoothies, soups, or even scrambled eggs. Getting creative with your turmeric use can make it easier to incorporate into your daily routine. Be patient and consistent. Like many natural remedies, the benefits of turmeric may take time to become noticeable. Give it a few weeks of regular use before deciding whether it's working for you. Keep a journal of your turmeric use and any changes you notice in your health. This can be helpful information to share with your doctor and can help you track any potential side effects or benefits over time. Consider the form of turmeric you're using. Fresh turmeric root, dried powder, and supplements can all have different potencies and effects on the body. If you're using supplements, pay close attention to dosage recommendations and any additional ingredients. Be aware of potential staining. Turmeric's vibrant yellow color can easily stain clothing, countertops, and even teeth with prolonged use. Take precautions when handling turmeric to avoid unwanted stains. In conclusion, while turmeric offers impressive health benefits for many people, it's not without risks. Being aware of potential side effects and interactions is crucial for safe use. By starting slow, staying informed, and working with your healthcare provider, you can make the most of this powerful spice, while minimizing potential dangers. Did you know turmeric could have these side effects? If you've had experience with turmeric, whether positive or negative, sharing your story can help others make informed decisions about their health. Remember, what works for one person may not work for another, and that's okay. If you found this information helpful, consider sharing it with friends and family who might be interested in natural health remedies. The more we know about the potential risks and benefits of substances like turmeric, the better equipped we are to make smart choices for our health. Always keep in mind that while turmeric is safe for most people, it can interact with medications and may not be suitable for everyone. When in doubt, consult with a healthcare professional before making significant changes to your diet or supplement routine. Your health and safety should always come first.